What about this idea of healthcare reform, too? He says, when you're looking long-term here, reducing deficits, reducing the overall debt, you've got to get the healthcare reform. You're on the board of Rush Medical Center in Chicago. What do you think about this idea? Because we're spending a lot of money on a lot of things other than healthcare.
Well, and as you know, we're spending more money on a per citizen and a percentage of GDP average than most developed countries, and yet we have 50 million uninsured. I think the difference between now and the early 90s is that there's no stakeholder who doesn't recognize that the system is broken and has to be fixed. We've got 14,000 families losing health care every day. That's a crisis. In business, it's a crisis to have the lack of competitiveness that the burden of health care costs is bearing by business. And from the government perspective, we've got a system that the health care costs are a major contributor to the deficits going forward. So I'm actually optimistic in talking across the aisle to both Republicans and Democrats that there is now not just a willingness, but actually a desire to tackle the need for health care reform.
There's all kinds of optimism out here this morning, and it's good to hear for
glimmers of optimism.
Always. Christy Hefton, Ryan Mack, always great to see you. Thanks for coming in this morning.
Thank you.
Karen?
Well, the Defense Department's developed